All right, today we're going to talk about something pretty incredible and, honestly, super delicate. It's the control center for your entire arm. We're talking about the brachial plexus.
So let me ask you something. Have you ever really thought about it? I mean, what powers every single thing your arm does? Waving hello, picking up your coffee. What's actually making all that happen?
Well, the answer is this amazing, super complex bundle of nerves called the brachial plexus. A really good way to picture it, think of it like the main electrical trunk line for your entire arm. You know, it's this huge network carrying all the signals from your spinal cord, right in your neck, shooting all the way down through your shoulder, into your arm, and right to your fingertips. It powers every single muscle and sends back every feeling.
But you know, like any critical connection, this one can break. It can get damaged or even completely cut. So, how does that happen? Let's get into it. So, usually the damage happens in one of two main ways. First, you've got what's called traction. This is a stretching injury. Imagine the nerves getting violently pulled or stretched out, kind of like what happens in a nasty fall or an accident where your head and shoulder are yanked apart. And then there's impact. This is more of a crushing force. Think of a direct, heavy hit, or maybe the nerves getting pinched and squeezed between your collarbone and your first rib. Ouch. And when you look at what actually causes these things, it's pretty eye-opening. Yeah, falls can do it, for sure. But the big one? High-speed accidents. And motorcycle accidents, they're way up there as a major cause, especially for traumatic brachial plexus injuries. We see this a lot, particularly in young men.
And to get a real sense of just how severe we're talking, just look at this number. In something like 72% of those high-speed cases, it's not just a stretch. We're talking about the nerve root being completely ripped away from the spinal cord. That's called an avulsion, and it is literally the worst-case scenario for this kind of injury.
Okay, so what does this all mean for someone's day-to-day life? Let's talk about the real-world impact, because the consequences can be, they can be all over the map.
Yeah, the range of symptoms is just huge. I mean, depending on which exact nerves got hit and how bad the damage is, someone might just have some minor weakness, maybe a little numbness, or they could end up with a completely paralyzed arm, totally limp, no function, no feeling. It's a massive spectrum. Let's get a bit more specific. Take a look at the upper part of the brachial plexus. When that area gets damaged, which can happen in a fall or sometimes even during a difficult birth, it can cause a condition you might have heard of, Erb's palsy. And this gives you a perfect picture of what that actually looks like. The source material has this fantastic, really vivid description. It says the arm hangs by the side and is rotated medially, the forearm is extended and pronated. It creates this very specific posture. It's known as the waiter's tip deformity. You can just picture it, right? Like someone is holding their arm behind their back, waiting for a tip. Okay, now what if the damage happens to the lower part of that nerve network? Let's say you're falling and you suddenly grab a branch to save yourself, yanking your arm way up. That can cause a totally different condition. This one's called Klumpke's paralysis. And this one is different from Erb's palsy. See, Erb's affects more of the whole arm, but Klumpke's paralysis, that really zeroes in on the forearm and the hand. The result is this super characteristic sign, what they call a clawed hand. And that's all because you lose function in those tiny little muscles inside the hand. So, okay. We've got different injuries, different locations, different symptoms, which leads to the million-dollar question for doctors, right? How in the world do they figure out exactly how bad the damage is?
Exactly. I mean, is the nerve just kind of bruised and it's going to get better on its own? Or is it completely torn and needs surgery like right now? To figure that out, they have a system, a way to classify the damage.
All right, let's break this down. The system they use most often is called Sodden's classification, and it puts nerve damage into 3 buckets, from mild to severe. First up, the mildest one, is neuropraxia. Think of this as a stretch. The nerve's outer insulation gets a little banged up, but the actual nerve fiber inside is fine. Good news here is that a full recovery on its own is super likely. Step 2 is axonematesis. Now it's getting more serious. The inner nerve fibers are actually torn, but that outer tube that protects the nerve, it's still holding on. Recovery here is possible, but it's definitely not a sure thing. And then you have the most severe one, neurotmesis. This is when the entire nerve is just cut in two, completely severed. There is zero chance of it healing on its own. Surgery is an absolute must. And this grading system, it's everything. It's so important because it tells the doctors what to do next. It basically lays out the roadmap for recovery, which, as you can imagine, looks wildly different depending on how bad that initial injury was.
And this really shows you the night and day difference in the outlook.
For those milder injuries, that neuropraxia we talked about, the prognosis is great. I mean, a 90 to 100% chance of getting all your function back, usually without any surgery at all. But for the really bad ones, a total rupture or that avulsion where it's torn from the spine, it's a whole different story. If you don't get surgery, and fast, there's basically no chance of recovery.
So what does treatment look like? Well, it's not just one magic bullet. It's a whole combination of things. You've got physical and occupational therapy, which is crucial for keeping the muscles going. You have splinting to support the arm. And then, for the really severe cases, you get into some pretty complex surgeries. Things like nerve grafts, nerve transfers, or even surgery to decompress the nerves and take the pressure off.
But you might be wondering, why all that therapy? Well, the thing about nerves is they heal so slowly. So a massive part of rehab is just about keeping the muscles in the arm from giving up. You're trying to keep them healthy and alive to stop them from wasting away. That's called atrophy. Well, everyone waits and hopes for those nerve signals to start firing again.
So look, there's no way around it. This is a devastating kind of injury. The road to recovery is long, it's tough, and it's just an amazing testament to how resilient the human body can be and to what modern medicine can do. But it also leaves us with one last, really important thought, right? Knowing what causes these things, what can we do to stop these life-altering injuries before they even happen?